money's always an issue. We had alluded to the type of state budget, but state federal funds are always part of what makes the system go. Is any of your work, at least in the 3 years, maybe in the shorter term, going to focus on things like private insurance coverage or Medicaid eligibility?
I think that certainly Medicaid, which funds more than 50% of the Children's Services and Community Services boards, has to be part of the equation when you look at it. And obviously, as we look toward the next session with the horrible budget situation that we face, everything is on the table for cuts. We realize that. But cuts to Medicaid and eligibility or services would be absolutely devastating to the public mental health system for children, because that, as I said, is over 50% of the funding. And certainly, the cuts that have already come down for CSBs in many ways, in many areas, have already affected children's services because certain things are held harmless from cuts. Certain things are funded other ways, substance abuse. A lot of those services are funded through federal grants. So children's mental health services have already taken a hit in some areas, and any further cuts, either to the CSBs or to the Medicaid budget, would really put us into crisis. As a long-term issue, I think we have to look at all the different funding pieces and the ways that families access services. And so certainly all of that would have to be part of what we examine.
Premature talk about Medicaid increases, given that it's budget.
I think that that would certainly be something that the campaign would consider. Today, I cannot say.
But there are broad issues about coverage in Medicaid, and if we can cover more kids and more families, obviously that will give some of them access to the mental health services they need. So it's linked to some broader health system issues as well, and those will have to be addressed.
Is there any idea how many additional facilities would be required to meet 100% of the demand?
Well, two answers to that question. No, we don't. But in your question, you might not have intended this, but the use of the word facilities, I would say that what we're going for is community-based services rather than facility-based services. So there's been a huge push. There's been a children's system transformation in this state over the last couple of years. And it's worked very hard to bring foster children out of residential services into more family-like settings and home-based settings. And certainly that's a best practice across the field of children's services and mental health services as well. So no, I don't have a specific number, unfortunately. And I'm not sure that anyone does, because I don't think that there's a state out there that treats all the children who have mental health problems, unfortunately. But when we are looking at services, we're looking at the most important thing is to have a wide array of services so that there are low-level interventions and less intensive services when parents first notice signs of the problem, that the child can get help hopefully before the problem escalates into a crisis. But there needs to be an opportunity for families and children to step up the level of intensity and the level of involvement in services, all the way up to hospitalization in the most intensive services, because despite our best efforts, there are always going to be children who end up in crisis. However, if we get more of those sort of front-end community-based services in place, we're going to prevent a lot of those children from escalating to that level of crisis.
Well, this is a rather complicated question, but I think kind of speaks to the heart of the matter. First of all, we commend you for putting this advocacy campaign together. I think you also point out that there are many good entities which provide professional work, but there's a lot of fragmentation. There's the public sector, there's the private sector, there's foundations, and so on and so forth. How do you intend to pull all of those organizations together under one umbrella which has one philosophical, sort of push, which is creating a non-siloed approach towards child mental health? Because it seems to me that in this fiscal climate, the collaboration between all of these entities is going to be key. And how do you pull those resources together so that the mission is the same for each of those entities? Each of them serve a certain function, but how do you bring them together? What role do you see? Because you talk about government and connecting with them, and then there are private sectors. So how do you sort of pull that together?
I think it's pretty clear that we will need a broad coalition in order to address the many aspects and many pieces of the system. So we're trying to build that coalition. We already have a start. You'll see in your press packet, you'll certainly see on the website, the list of partners who are already enrolled and already on board. But we need additional partners, and part of the campaign's early on tasks will be to recruit even more partners, more of those stakeholders in the system that can participate with us. And then the campaign and the coalition really needs to go through a consensus building process. We all need to be on the same page eventually about what's needed, how we're going to work together, what the objectives are that we all buy into and agree on. So that process has not taken place yet. We've got the partners in place who want to work on this together. We have significant commitments, both financial and other in-kind resources, to make this work, sustain it for a number of years. Now the hard work begins of getting everybody together and building consensus. So that's what the coalition is all about. What you'll be hearing more about as we go along, how we're approaching that consensus building challenge, which, as you've outlined, is
I guess my question more is sort of to this innovative concept of perhaps having a federation which is outside the advocacy campaign, which actually is the action arm of actually moving this forward by creating coalitions between public, private,
Every
foundation.
methodology is on the table. We don't have a prescription, again, for how this campaign should unfold, because we have partners to work with, and all these decisions get made by the coalition and partnerships and by consensus. So, again, it's a process. Today, we've launched the process. Today, we've assembled all the resources we need. We, meaning the coalition and all the partners, have assembled the resources that are needed to put the kind of effort into this that's been required, but not quite in place in years past. It's a new day. We have things in place now that have never been in place before, and an opportunity that's never been in front of us before. And we hope that we all work together. We think that that's exactly what's going to happen. We're all going to work together to make this succeed in the next 2 to 3 years. I want to try to bring this to a close. I know, just to make sure though, any members of the press that have not received a press packet, we have them available up here, so please come on up and grab one. And we will be staying here, and you're free to come up and ask us questions individually. All the steering committee members and other partners who are in the audience are glad to hang around and try to answer more questions if you have any. So unless there are final questions from members of the press, how about if we wrap things up and just make ourselves available for individual questions. And once again, on behalf of the coalition and the campaign, thank you very much for being here. Thank you for your interest in making things right for kids who have mental health problems. We hope that you'll be with us for the next 2 to 3 years as we work to make things better. Really appreciate your interest and support.